I'm Dr. Bazio.
I'm Dr. Cantamillo.
And I'm Dr. Bergschneider, and we'll be talking about congenital heart disease.
Congenital heart disease is mainly caused by factors during pregnancy. If the mother is a smoker, a drinker, or takes certain medications, such as some for acne or bipolar disorder, the risk of heart defects or diseases increases. Additionally, if the mother has type 1 or 2 diabetes during pregnancy, the risk of congenital heart disease is higher. If the mother has rubella during pregnancy, then the development of the baby's heart may be impacted. Lastly, it could be genetic and is usually associated with genetic defects such as Down syndrome.
This is the heart of somebody who is affected by congenital heart disease.
Luckily, the symptoms of congenital heart disease are clear, which means that the baby can be treated as soon as possible. Some symptoms include abnormal heart rhythms, rapid breathing, and extreme tiredness or fatigue. Some more physical markers would be a blue tinge to the lips or skin, swelling of the legs, stomach, and around the eyes, or tiredness and rapid breathing when the baby is feeding.
Cell signaling is vital for the function of the heart. The cell signaling is done mainly off the G protein coupled receptors. Throughout the process, the activation of protein kinases, A, G, and C, contribute to different and important functions of the heart. The G protein binds to the adrenoreceptors, which activate the adenylyl cyclase. CAMP, known as the second messenger, is generated, which activates protein kinase A. Protein kinase A then phosphorylates ion channels and other endogenous structures. This leads to an increase in heart rate and more myocardial contractility. In this diagram, nitric oxide goes through the plasma membrane and activates guanylate cyclase. This bond activates cGMP molecules, which trigger the activation of protein kinase G. MSP phosphatase is activated, which releases vascular smooth muscle cells. The release of these cells provide vasodilation or relaxation in the muscle cells. In the following diagram, nitric oxide goes to the plasma membrane. It activates protein kinase C, which preconditions stimuli in the cardiac muscle. Transcription factors are phosphorylated and proteins are disabled. This process increases protective genes in the myocardium, which increases overall cardiac protection. Faulty cell signaling mechanism occurs in the nodal signaling pathway, which is responsible for all embryonic development. During this process, the ligand binds to a TGF beta receptor consisting of type 1 and 2 receptors. They only bind to EGF CFC proteins. The serine and threonine kinases from the type 2 receptor are activated along with the type 1 kinases. The pathway is composed of lefty family proteins which inhibit activations of the TGF beta receptors. These proteins bind to the TGF beta receptor and prevent the binding of the receptor to the EGF and CNC proteins. This causes its left-right laterality defects such as gene mutations in lefty family members. This leads to congenital heart defects, which include levotransposition of the great arteries, the wrong position of the pulmonary artery and aorta, and atrial isomerism.
Depending on how severe the disease is, treatment options can include a catheter, heart transplants, and other invasive procedures. A catheter is a tube that is inserted into the patient's leg veins or artery and goes up to the heart, which has a device that treats heart valve problems. One of the main researchers for congenital heart disease is the Children's Heart Foundation, which focuses on improving the survival rates and helping with the treatment of patients with CHD. This organization looks at the genetics, the causes, better treatment, and lifelong issues that patients might face.